So thank you very much, Dr. Rania, for your nice talk and for introducing me to this very important meeting. It's a pleasure to be here. And my topic is patient coaching and onco-coaching in medicine. And we ask ourselves, is enabling patients to make better decisions about their care a possibility with onco-coaching? My conflicts of interest are listed here. And I would like to start with our challenges in oncology in 2024. This is an important topic since we see, due to demographics, an increased number of cancer patients every day. And we also face the problem of the complexity in diagnostics and therapy, which has a great impact, and there's lots of success in this field. We have a more digital medicine issue, and not all countries, including Germany, are very positive in this way. But altogether, we have a lack of physicians' time and a lack of nurses and physician assistants who can help us and who can help the patients. And the situation of the patient is still quite difficult because cancer is a very dangerous disease, and patients are scared and are afraid, and they have issues they need social support, they need doctor support. The complex therapies are difficult to understand. We need communication, and patients also suffer very often because they are often elderly patients. They suffer from comorbidities, and even in some cases, they are emergencies due to the disease or the treatment. Our approach to improve the situation is onco-coaching. And what is onco-coaching? It's an innovative model of care which is achieved by non-medical services to trained nurses, and we call them patient coaches or onco-coaches. They should accompany the patient in structured and demand-oriented appointments through the therapy, in addition to the appointments with the physician. And we hope that this can help and support patients' needs. And we developed a program first to train nurses to become an onco-coach. And then the onco-coach should also help the patients in different issues and different topics and models. For instance, improve the knowledge about the disease, or discuss physical activity and nutrition issues with the patient. Also discuss social issues and emotional experience in this difficult situation, and how patients could cope with stress and fear. One important point in the situation for therapy, concerning therapy, is adherence to therapy. And there is a considerable potential for side effects through oral agents, through drug to pills. And patients should be empowered for self-management, to understand that they should take the pills and also adhere to the therapy, because pills do not work if you don't take them. And therefore, medication adherence is crucial for treatment success. And we ask ourselves whether a systematic patient education program by oncological nurses can improve patients' competence. And for that, we introduced a clinical study, and which should implement patients' competence in oral breast cancer therapy. The aim of the study was to evaluate effectiveness of a standardized patient education and coaching for therapy management regarding persistence rate and so on under treatment with a CDK4/6 inhibitor, which is a standard treatment in metastatic breast cancer. This slide shows the clinical study design. It was a randomized trial in Germany in patients who have certain characteristics in their tumors, namely a metastatic breast cancer, hormone receptor positive, HER2 negative, and patients were treated with an oral drug, CDK4/6 inhibitor, plus endocrine therapy, and was randomized to a standard patient coaching with a tool, the MOA tool, versus standard patient management according to local practice. A one-to-one randomization, and the observation time was 24 weeks from beginning of the oral treatment therapy. This result is shown from this trial and shows the primary endpoint, which was the persistence rate after 24 weeks. And as you can see, the MOAT tool was better than the treatment according to the standard treatment, and was a higher persistence rate in the coaching patients group as compared to the standard group. In conclusion, there was a significant benefit in persistence rate after 24 weeks observed with the coaching tool using the MOAT tool compared to local standard of care treatment. Persistent time was better in the MOAT arm compared to local treatment standards, and there was also a slightly reduced SAE, severe adverse events, in the MOAT arm. So our conclusion is that the standardized patient coaching provides the opportunity to improve therapy management of all cancer therapies like CDK4/6 inhibitors. With this, I would like to end and hand over to Reem Aladel for question and answer. Welcome, Reem.